So, good morning, everyone. It's really, really nice to have an opportunity just to have a chat with you this morning. And we know that Brandon Adventurers, you're such a crucial part of Brandon Trust and the work we do. And so this conversation is just being able to share a bit more about who you are, what you do, and the impact that the work that you do make. So, shall we just do some introductions? Tell us who you are. Nathan, do you want to start?
Yeah.
Tell us your name and how long you've been in the Adventurers.
Name's Nathan, part of the Adventurers, been there from the beginning, which is, I think it's about 4 years.
Great, fabulous, and we'll hear a bit more about the work you do in a sec, but let's go around the group. Janice.
Hi, I'm Janice, I'm the Adventurers, and I joined, it was 2 years ago, wasn't it, Rach?
2 years ago.
Yeah.
Great. And you've been very busy since. We'll hear a bit more about that in a minute. Great. Tom.
Hi, I'm Tom. I'm part of the Adventurers, and
How long have you been in the Adventurers, Tom?
for about 4 years.
Great. And we'll hear a bit more about it. So let's we'll get some examples of the work that you've been doing in a sec.
Yeah.
Riley.
Yeah, my name's Riley. I've only been in Adventurers about a month and a half at this point, so
Great.
not very long.
So the newest member.
Yeah.
But it'd be really interesting to hear more about your experience
Yeah.
of joining the Adventurers. So who could kick us off by telling us what the Adventurers is as a group and what is it that you do? Who'd like to answer that question? Anybody willing to kick us off?
So just a group of us, but are in supported living, but stick up for people, but give the people a voice, but don't have a voice or don't have the opportunity.
So you live in your own home.
Yeah.
You're living your life your way.
Yeah.
And you're somebody that can use your experience and the expertise that you have to help other people have the opportunity to live their life their way.
Yeah.
And we would say that the work that you do, the expertise that you have, is in something called co-production. Can anybody sort of give us your take on what does co-production mean? Have you got an idea about that, Janice?
Yeah, like working together with different sort of people and working together with like people from all walks of life and getting their ideas on various things, like for example how we can do a film if it's a film, or for example how we can design something to go online, for example, if we're doing that, because everybody has like a range of different skills and different ideas, and it's just brilliant to see it all come together, like when we do the training, like when we write up their trainings and stuff, and when we sort of do our presentations, like the ones that we did for like the prescribers with Yui and stuff like that, and when we sort of showed them as well.
Yeah, and we're going to come back to some of those really important projects that you've done outside of Brandon. But I think when we think about co-production, we think about what change do we want to make, and how do we make sure that that change is going to actually make a difference, change things for the better, improve things for people we support. So I think co-production is something that means that we can truly co-produce a solution so that it works as well as possible for people that we support, for people with learning disabilities. Can you just give us maybe some examples of some of the things that you have done internally? So I'm thinking within our work in Brandon Trust, what are some of the projects or the initiatives that you've done internally for our work in Brandon?
So I was involved with the social impact meeting.
Brilliant.
And we spoke a lot about different language that we wanted used in, like as a service user, that I wanted used for my care and my support, and how that language affected me, myself, and talking about how I'm affected by that, not just people in offices deciding what's best for us.
Yeah, and I think that's a really important thing about co-production. It can never be about some people deciding what's best for others.
Yeah.
It's about how do we have that conversation so that you can say actually what works well for you.
Yeah.
And language is a really important part of that. It can make people feel included, can't
Yeah.
it, if we get language right. That's a brilliant example. Thanks, Riley. Other examples of things that you've done internally within Brandon to try and make our work more inclusive, more meaningful for people we support?
I'd say the the home visits, like the
The quality checks.
yeah.
Yeah, great. So tell us about the quality checks.
Um,
How does that work? What happens?
where we go and visit a location or house or whatever it is and ask like the residents that are living there questions like and get feedback on them and also see the staff and see how they're working and give them feedback or get feedback on them and sort of sometimes we have to also give them like recommendations or like suggestions on like how they can work better to make it better for the people supported there so they get the most out of it.
Great. So you're bringing your experience and your expertise into that assessment of quality and saying, from your perspective, you're noticing things that could be better. Do you know what I hear? What people tell me, Janice, is that when the adventurers come up with recommendations for improvement, that those recommendations are always the first to be acted upon. They're the quickest to get sort of resolved or taken forward. So I think you're doing a great job. So those are some really good examples of where your expertise is really making a difference internally. Let's think about some of those external things that you're doing. So you mentioned UWE. So UWE stands for the University of the West of England. It's a university very near here in Bristol. But tell us what you've been doing with that university, Janice.
Was that was when we did the inclusive consultations presentation. We did that with them, and then we also did. What was the other thing we did?
The end of life conference.
At the end of life conference. Oh yeah, that's when me and Leon presented.
Great.
At
And
the
what
end
did
of
you
life
present
conference
about?
there. We talked about death and dying and like how to like support people in their final hours of life and that and stuff like that and like obviously like having respect like if somebody wants to die alone or if somebody wants to die with I don't know their favourite song playing in the background or if somebody wants to die surrounded by friends and family.
Great. So when we think about the choices that people want to make for their life, we're thinking about the choices that might be relevant all the way through the course of their life. And I think what you were presenting about is even at the very end of somebody's life, it's important that people with learning disabilities have their choices understood and respected. Is that right?
Yeah. And some people might just want to essentially die in peace and quiet with nobody around
Yeah.
and
Yeah.
in complete silence. Everybody's different and everybody has their different views on it all, I guess, as it's like as everything is like it's a unique sort of thing to everyone.
Yeah. We're all different. We all inevitably have different choices that are right for us. I was thinking about just in the time that I've been here at Brandon, what I've seen is that the adventurers have just become more and more recognised, well known. When I go out and about, people ask me all the time what the adventurers are up to.
Yeah.
So I think you've become a group. You've got a really, really good reputation and track record now.
Oh, that's good, lads. That's good to hear. Well done, team. Well done. Thank you,
done,
Maisie
team.
and Rachel, as well for all your help.
Yeah, well done, team.
And well done to you two for all your help organising everything. And thank you again.
So let's think about, so when people recognise the work that you're doing, I think people recognise that it makes a difference, it has a really positive impact. So tell me, what do you think is the impact of the work that you've been doing? What difference does it make?
Well, I like the fact that it's easier for everyone else to see like paperwork now coming through because we've done like easy read versions instead of having this giant thing.
Yeah, great. So
But it's helping people out there which like struggles like I do, and if I'm struggling with it, other people will.
yeah.
And we're making a difference for everyone.
Yeah, so communicating in a way that really helps people to understand, and therefore they can be involved, can't they, in the conversation or in the decision making?
Yeah.
Yeah, brilliant example. What other difference does it make?
I think, especially when we're doing inclusive consultations with the students from UWE, it was really important to me to hear the feedback and them going, oh, I did that thing and I didn't know that could be wrong, and really learning from what we were saying and like being able to advocate for everyone in Brandon Trust and everyone with a learning difficulty or autism in a much wider way. And I don't think we would even notice the impact we're having,
Yeah.
because I think it is so big and so unbelievably untangible
Yeah,
at
yeah.
this point. I think it's really important.
That's such a good example, and it is about people understanding maybe something for the first time because of the way that you've communicated it, and they might not have had the opportunity to understand that really important difference that they can make to include people with a learning disability.
Yeah.
Tom, what about you? What impact do you think the work that you've been doing in the Adventurers has made?
I think it's made a huge difference. I think I quite like the stuff with Yui and that. I also like the online meetings that all of us have with like when there's like 100 and whatever I want to call.
Yeah, it's a lot of people, isn't it? Yeah. I think in terms of those online meetings and presentations, as you were saying, Tom, you can reach a lot of people all at the same time, can't you? Yeah. So a lot of people are getting the opportunity to again learn from your experience or from your advice and recommendations.
Yeah.
And what would you be saying to people? Because I hear some people saying, oh, change is hard, people don't like change, change only happens very slowly. And I think at Brandon, we're really up for change, aren't we? We really think that there hasn't been enough change yet in society for people with learning disabilities. So what might you say to people that are saying change is hard, it can only happen slowly? What would you say?
Well, it needed to happen like ages ago.
Yeah. So hurry up.
And it's good to see like from like for me wise, because I know it's going to help a lot of people.
Yeah.
And I like helping people.
Yeah.
But it should have happened ages ago with everyone. Like we all got like pretty much labelled and stuck to a side, and now we can actually do things more and actually get out more, and we can actually start doing our own things in our own life.
Yeah. So we've got to keep on trying to see the next change that is going to really make a difference.
It's like there was nothing in place at one point for people if like they had a family member like go on and like there was nothing there for them. If they got no family there was nothing there to help them.
Yeah.
Now we've got something there.
Yeah.
And
Right.
it's nice to have something there because there was nothing there to begin with, and for everyone else there's counselling or other things like that for other people.
Yeah.
It's the listening lounge is the thing that helped me as well at points. But it's
Tell us a bit more about the listening lounge. What is that, Nathan? For people that might not know.
it's for people who've had like family members, it could be a pet, it could be anything that they've lost. You don't have to speak, you can sit there and listen, or you can try and open up and see how you feel. There is like, she puts these like little different things, she does different things like each month. Because all the like she changes it up like each month. Like 1 minute we're planting plants in this pot and making pots, and then it's gone from that to painting, or it could be anything. It's random, but it's quite. I do like going to it sometimes because it puts me at ease.
And do you think that's one example of where maybe even as a society we can better recognise that people with a learning disability do experience grief and loss and bereavement just like everybody else does?
No different.
Yeah, exactly. Yeah.
Just half the time we've got no one to lean on, and we just shut down.
Yeah.
So we give up on stuff.
I went to my first listening lounge last month, and I haven't been in Brandon very long, but it was the first time I've actually been able to be somewhere where I could talk about my loss and talk about the grief in a space that was safe, whereas kind of every other grief support is either one-to-one, or I was too complex for them, or they couldn't deal with my extra needs or stuff like that. So it was really nice to actually have a space where I could go to and I could be supported at, and it wasn't judgmental.
Yeah.
It wasn't like I've come with my support worker today, when actually it's just pretty normal that I could have support there, or I didn't need to if I didn't want to.
Yeah. I'm thinking about some of those other changes that you want to see. Let's think about changes either in Brandon or changes, in the places that you live. What do you think could make life better for people with learning disabilities? Janice, have you got an idea?
I've got. What was it? I had it. Basically, like for people to sort of like, people are getting better at it, but for people to sort of realise that people like with learning disabilities or whatever their background and whatever their sort of needs, they can still make like sensible decisions about their lives and about like, you know, what they're going to do with their lives and stuff, and they're actually quite clever.
Yeah. So making decisions with people, not for people, that's still a really important shift.
And they're actually quite clever, so not for people to be sort of surprised by, like, yeah, oh, they've made that decision, that's really clever. Because I think when I was in secondary school, because obviously I've got the visual impairment, I think people were surprised that I wanted to do things like the Duke of Edinburgh Awards, for example, and that I wanted to do the other stuff that I've done, like the Princess Trust Team programme as well, that I wanted to do stuff like that, and that I was like able to do it sort of thing. They thought like my visual impairment would hold me back, but I proved them wrong. I went and got all the free DAVs, bronze, silver and gold, and got the Princess Trust Team programme as well.
Well, do you know, Janice, I know you quite well now, and that doesn't surprise me at all. But I think you're making a really important point, which is about people should be seen for their strengths, their talents, their abilities, and we shouldn't make any assumptions about things that might hold people back. What we should be trying to do is remove those barriers.
Yeah, I agree, because I think that's what schools sort of thought when they sort of saw that I had a visual impairment sort of thing.
Yeah. And, you know, we're so proud of the work that you do as Brandon's Adventurers. I'm sure you must be proud too. Just give us one example of something that you're particularly proud of that you've done as the Adventurers.
I think for me, sorry.
No, you go first. You start.
I think for me it was in that meeting where essentially I explained to someone that I didn't like being touched, and like a doctor would be like, oh you're right, like pull you and stuff like that, and I was in hospital at the time, and it made me quite angry, and explaining how that was the wrong thing to do, and they instantly took that and was like, I'm going to change my practice, I'm going to change what I'm doing because of what I said.
Yeah.
And I think that was really important.
So you could see that very powerful link between
Yeah.
what you said and what they were going to do differently.
Yeah.
Great. Fantastic. What are you proud of, Nathan?
The main thing I'm proud of is meeting my whole team and seeing a difference with everything.
Yeah, knowing that the work that you do together really makes a difference. But Tom, tell us something that you're particularly proud of.
Well, I'd say the two things that I'm proud of are the London thing, and also just going in, like when we go to do home visits for a second time or something, seeing the change or seeing that things are actually on track.
Yeah, that your feedback has made a difference and people have acted on it.
Yeah.
Brilliant. But the London thing, I know what you mean, but tell everybody else, what do you mean by the London thing?
The protest march.
Yeah. So, and there's a fantastic film. If people haven't seen that, we could share that link, couldn't we?
Yeah.
But basically, you were up there in London,
Yeah.
outside the Houses of Parliament, making your voice heard
Yeah.
for policy changes that could positively impact social care in the UK if we get them right.
In the hope that the government actually heard.
Yeah, and we'll listen and we'll act on that feedback. Yeah. Janice, what are you particularly proud of?
Just like the team for a start, and Rachel and Macy for helping us all out, and like all the work we've done. But I'm proud of winning the award that I won.
Oh, come on, tell us about that then, Janice. What award was that?
The Women in Superwomen in Social Care, the Learning Disabilities and Mental Health category. So I went up to London for this gala awards evening, and I won out of 11 other finalists.
Fabulous. And honestly, we are so proud of you. Well done, Janice. Fantastic achievement.
I think the best bit as well is we never actually go out intentionally to try and win all these random trophies.
No, they just come your way, Nathan.
Yeah, I don't know. Somehow I know we're going to get a trophy, and I just get a bottle of wine, and we got a trophy.
The weird thing is that we get more trophies than England.
Than all the
do in
rest of
World
us
Cup.
put together. Yeah. So one question I'd really like to ask you is about the work that you've been doing on training. So I understand that within Brandon, you have helped us completely change our approach to Mental Capacity Act training. So who's going to tell me why the Mental Capacity Act is important?
It's important because if it's not done right, we could lose like our rights to make our own decisions, and because if somebody lacks understanding on a topic or on whatever you're discussing with them, it doesn't mean that they lack capacity to make their own decisions. They just may need more time to think about it or need it in a different format. So if they don't want to read a lot, for example, they might just want a snippet like a voice note or it in a podcast even, for example.
Absolutely. So the Mental Capacity Act is a way of upholding your rights as individual people. And tell me about this training. What's going to be new and different about the training now that you've helped us overhaul our approach? Who can tell me a bit about that?
I think it's really important that we're involved in creating the training and delivering the training
Yeah.
as well. It's all coming from our voices and what we need in our lives, not from the people that are in the offices that don't necessarily know what's going on
Yeah.
in the big picture.
And my guess would be, with you delivering it, people are going to be more interested, more engaged. I think they'd probably listen more carefully to that training. So what I'd really hope is that people can really learn as effectively as possible because you're really at the forefront of delivering that training.
Yeah.
Nathan, do you want to add?
It's just we've got lived experience as well for
Yeah.
the whole training as well. So we're not just going in there randomly.
Yeah, absolutely. Yeah, exactly. Yeah, you're
I
coming
just don't
at
like
it.
wearing my badge.
Yeah, you're coming at it from that lived experience perspective. Yeah, great. And what about research? Because I know the adventurers have been doing quite a lot of research with different research partners, universities, other organisations leading research. Who'd like to tell us something about that? Janice, are you going?
Yeah, we started working with Claudius Bright.
Great. And for people that don't know anything about Cordis Bright, shall I just say a little bit about that? So Cordis Bright, they're quite a well-known, well-recognised consultancy, and they're very active in really sharing, I think, data, knowledge, insight that comes from different sort of research projects. So people are informed and can make decisions for their organisation. That's essentially what Cordis Bright does. Tell us about the research you're doing with them.
We're doing research about like how to get like people with like learning disabilities into work and how to sort of keep them like in their jobs and stuff like that, and ways to sort of manage like barriers as well, like say there were not so good transport links, for example, and stuff like that, ways how to manage all of that to sort of keep those people in work and stuff, because people from whatever background or age or whatever, like people have so many skills, and this is what I like about working with the adventurers, seeing all of our skills come together and seeing the work that we do is just really good. So well done everyone on the work.
Brilliant. And just like we really benefit in Brandon, don't we, from having your skills and expertise helping us do our work in Brandon. Other organisations could similarly benefit from the skills and experience that people with learning disabilities can bring. So helping people, supporting people into jobs is a really important thing, isn't it?
Yeah, and so they can sort of keep their jobs as well if they enjoy them.
Fabulous. Great. So can I just say a huge thank you to you all. It's been really interesting talking to you today, and I know that other people will be, I think, interested to listen in on our conversation. But Tom, I'm going to hand over to you for the closing comment.
Well, one thing that I always say in meetings is, with the MCA and stuff like that, is what happens if people lack the capacity to understand our answers.
Well, I think what you've shown us today is that actually, through conversation, we can help develop people's understanding, and that's what we want, isn't it? For people to have a really good understanding what makes a difference to you, what makes a difference to other people with learning disabilities, so that we can genuinely help everybody to live their best life. On that note, I think we'll finish. Thank you very much indeed. Thank you.